All right. So, on behalf of the BC Brain Wellness Program, I want to welcome you all to today's Care Partner Workshop, Transforming Care Partner Trauma, Emotional and Mental Plasticity with Miriam Lapine Lyons. And I'm really excited to have Miriam with us today. Her full bio is on our website, and Martina will pop it into the chat as well. But Miriam and I have a lovely, long history now.
Yes.
When we connected initially and met each other and worked together with the Parkinson's Society of BC a long time ago. And since then, she's moved into private practice, and I pulled her back to work with me again with the BC Brain Wellness. She was trying to get away from me, but I was just not about to let that happen. And
Never, never.
yeah, so pulled her back when the BC Brain Wellness Program launched, actually, and really tapped into her talents in a variety of different places along the way. She works, has worked in the field of mental health as a registered clinical counselor in Vancouver, supporting people with a variety of different challenges, and has a special interest in working with those living with chronic health conditions. And so, just so happy to have you with us again.
Thank you. That's very
So,
kind.
with that, I am going to turn it over to you, Miriam.
Thank you, Elaine. I really appreciate that. And it's true, it's been such a long time since we've known each other, and I'm so grateful for that relationship that we've built over the years. It's been I see Elaine as like a mentor to me. So it's really nice to come back and to work again together. Um, so I'm Miriam. I don't think I need to do much more introduction, except for something that is very near and dear to me, and do my online acknowledgement because while I am working with UBC, I also live and play on many of the unceded territories, specifically of the Musqueam, Squamish, and Tsleil-Waututh nations. And so I hope that each of you, wherever you are in British Columbia, I've noticed a couple of people on the Sunshine Coast and in the interior, um, can just think about, the land that they're on and how they're using it, and hopefully it's with respect and love. So Elaine has shared a bit about me, and I think the only additional information that I would add is that I'm embracing being a new mom, and so I'm coming back after mat leave, and I see some familiar names and faces, and I'm just so excited to be here. And it really warms my heart to kind of come back to this community that I really do appreciate and love. Um, Today is going to be both kind of presenter and learner information and mode, as well as experiential and participating mode. And that will come closer to the end of our time together. But I just wanted to give you a brief outline of kind of what we'll be going through and talking about. And hopefully, if you have questions along the way, you can put them in the chat. I do my best to kind of come back to those at the end of the session. But hopefully, if my presentation is good enough, I will have answered as many questions as we go along. So it's very typical, that after a diagnosis, there's often stress for everyone involved. But this stress could be very unique to you as a care partner. And so that's what we're going to be talking about today, and seeing, what is stress? How does it show up in different ways? And actually learn that actually sometimes stress can, not for everyone, but sometimes lead into an experience of trauma or traumatic experience. And so we're going to learn a little bit about how to identify that kind of experience, as well as how to resolve it. And I think that's the biggest piece that I want us to do together, which is why we're going to do some experiential exercises together to put into practice and maybe build some of those skills. So I want us before we jump in, I just want us to take a moment. We're all here for the first time. You've made it. Congratulations. It's a big feat to just carve out some time for yourself, I know. So maybe just take a moment to like look around your space. And while I can't see you all personally, I just want you to really take a moment. If there's a window nearby, look outside. We're going to be spending the hour and a bit together. It might bring up some experience in you as we talk about these maybe difficult or tricky topics. But my hope is that you take care of yourself as you listen in and you participate. So, looking outside, seeing maybe a leaf or a tree or a plant of some kind, maybe there's some in your space. Just know that um, you can be present, you can move around, you can turn off your video, you can turn on your video, whatever makes you feel comfortable um, as we get going. So I want you just from the get-go, as you kind of come back to the group, just write a few words in the chat if you want. You don't need to. That might describe your experience as a care partner after receiving a diagnosis in your family or your social network. Um, because diagnosis can mean lots of different things to everyone. And it's interesting to see what people's experiences are. Um, so maybe I can't actually see the chat right now, but that's okay. Just kind of, if you are writing down, or if there are some words that are being written down, just kind of observe those and maybe how you're reading them, how you're taking it in. Um, in the
Mi-
past, when yeah,
Miriam, would it be helpful for me to share those with you if you
oh,
can't see them?
you know what? I see them right now. Let me
Okay,
just open. Yeah, the little dialogue box popped down, so that was good.
okay.
Yeah, so thank you. So I see, yes, challenged and sad. Absolutely. I've had some people say frustrated. Yes, absolutely. Grief, loss, overwhelm. Shocked. Yes, that's a big one. hmm I've also had people say relief, actually, because sometimes, oh, here we go. Yeah, some relief. Because sometimes it can be such a process to getting a diagnosis. And sometimes for some, not all by any means, but for some, it can be nice to know what you're finally dealing with. But then what we notice is that after the relief, there is often other emotions and experiences that get experienced, such as, yes, anticipatory grief and having to be the one in control and in charge. So, a lot of pressure maybe being put on one person or a few people. And so, as some of you have written down, it sounds like there's a lot of experiences of stress, of worry, lots of emotions, and maybe even some anxiety of what it means to receive a diagnosis. So I so appreciate everyone just sharing some parts of their experience so far. And I think for most, you've probably noticed yourself kind of oscillating, so swinging from one end to another in different emotional experiences, or even based on different environments or different social environments. And this is not surprising because it's a very normal for us to feel lots of different things at different moments in time. Um, but I think what is tricky is that this is receiving a diagnosis in the family or in the social network. It is a very dramatic change to our lives. And so feeling stressed is actually a very normal response to receiving a diagnosis. And so I want to break down a little bit what stress is. It is a normal response to a situation like receiving a diagnosis, like being a care partner to someone with a diagnosis. And there's a few models of understanding stress. The four F's to me, which I'll kind of show you in a little bit, is maybe a simpler way of understanding. And maybe actually you can start to identify yourself in some of the stress responses that I'll kind of go through. Um, think of these responses as innate responses that support your survival. So, this is all about, even though they might feel intense or quote unquote negative, they are actually part of survival. And it happens automatically or autonomically, which means that we don't have conscious control of this. This is just your body and mind engaging in um, a survival technique based on a perceived or real threat or danger. They can also impact our behaviors and the perceptions of ourselves, of others, and also of our environment or the world. Um, and so they sometimes, depending on what has happened in our life, they can also be reinforced by past experiences. But most importantly, these stress responses are changeable. And so, one of the first ones that we can maybe observe in others or in ourselves is called the flight response. It's when we kind of just something happens, something as we perceived as dangerous or alarming happens, and then we kind of just like walk away or we leave the situation. The next response is called fight, and it's where we actually become more kind of confrontational with the situation, whether that's a person or actually an environment. The next response is called freeze, and it's when we actually are still present. We don't leave or we don't fight, but we actually just freeze, like deer in the headlights type of thing. Don't know what to do. Our body is just kind of there, um, and there's just so much happening on the inside, but our muscles are actually kind of dormant and they are inactive, and we just stay stuck there. So people kind of say like you're zoned out or you're kind of spaced out. That can be a freeze response. And the fourth F is called fawn, or also known as people pleasing. And that's when you actually appear very engaged and very connected to the experience that has caused a threat response or a stress response. Um, but actually, you're just totally ignoring what your experience is and what your needs are. And you are just giving yourself to the situation or the other people. So I want you to also just know that, again, these are not something you can consciously control. They happen without our conscious knowledge, but they're there because from an evolutionary standpoint, this is how we have survived. And it doesn't mean that these are actually not bad. These are good ways of responding to threats um, and tricky situations. I think what happens is that if we get stuck in them and they kind of last for a long time, and we notice a big discomfort about being in those responses, that's when it becomes challenging for ourselves and it impacts ourselves negatively. So, as we've just learned, it's normal for your nervous system to get activated throughout the day, especially with the realities of being a care partner. And I love this image because it's just so representative, at least what I have experienced in a day at any given moment, but also maybe what you have experienced. And so, as care partners, there are lots of realities that you're faced with. There's uncertainty, it's hard work, there's emotional, social, physical, and even financial pain. And so when your system is overloaded and overwhelmed, I saw that word a few times, overwhelmed, the experiences of stress can sometimes evolve into what is known as a traumatic experience. And so trauma can be the result of being triggered into overwhelmed, or as actually a Vancouver Canadian physician, Gabor Mate, I don't know if any that rings a bell to anybody, said in his movie, The Wisdom of Trauma, he said, trauma is what happens inside of you as a result of what has happened to you. And I just love that because it really helps us to understand that what is deemed as a traumatic experience is not something that is, you have to check these boxes necessarily, but actually is more about what you feel. And the unfortunate reality, according to the Canadian Psychological Association, CPA, is that approximately 76% of Canadians have experienced a traumatic event during their life. And that's just one traumatic event. I think 76% of the population has experienced probably more than one traumatic experience. And receiving a diagnosis in your family or your social life can be one of these experiences. So, while there are certain events that are commonly seen as being traumatic, there's no way of definitively, you know, saying which are and which aren't. Again, it's what happens inside of you as a result of what has happened to you. So each individual is going to experience their own events and will interpret that in their own ways. It can be helpful to understand that there are kind of different types of trauma. And if some of these resonate for you, I really urge you to take a moment to just take a breath, like, and, consider, talking to someone, whether it's a professional or maybe someone in your family or maybe in your friend circle to say, hey, like, this is actually impacting me a lot more than I maybe realize. And that realization, that awareness of something, stress and or a traumatic experience is something you've experienced is kind of one of the first steps in actually creating change around it. So, to just help us better understand what traumatic experiences can be, there are these kind of two main categories or types of trauma that we can experience. There's single event trauma and there's complex trauma. And single event is, as the name suggests, it's an event that happens once in our life, whereas complex trauma is something that happens repeatedly over a period of time. And so, I'm not going to kind of go into the details of that, but I think you can all start to imagine what the differences can be. And for your own knowledge, when we kind of fall into more complex trauma, the road to feeling better is often a little bit longer with that because of the complexities that are involved in the traumatic experiences. Um, and for both single event and complex trauma, there is an ability to change and to live differently after what has happened. So I just want to kind of instill that sense of hope, hopefully, in you as you continue to lean in to this conversation. Um, and again, it's important to mention that traumatic experiences impact individuals differently based on personal, social, economic, and environmental factors. So I think most importantly, um, when we've experienced something hard or even traumatic, there often presents itself an opportunity for change. And it can be really difficult at first to know that something can change, that you can start feel differently about that experience. Um, but if we build the skills to become more self-aware, both emotionally, cognitively, or mentally, um, we can find little opportunities where we can start to create that change, whether the start, the middle, or the end of an experience. Um, and we can find safety and connection again. Now, what does that really mean? What is feeling safe and social? Um, this is actually when we are feeling kind of at our best or content in a way. This is when your parasympathetic nervous system, so your rest and digest system, is activated, it's engaged, unlike the stress response, which often activates the sympathetic state. So this is when you're feeling calm, curious, connected, compassionate, confident, courageous, and clear. So these are also known as the seven C's or the open hearted state. of our authentic self. It's kind of our capital T truth where we just are. And it's hard to sometimes identify when we just are, because these qualities are actually very subtle. They're not so intense like stress. Stress is so easily noticeable in our body because it wants us to notice it. These states of safety and connection, so the safe and social state, is subtle, it's soft, it's less intense. And so it requires us to actually pay attention to those qualities in a way that maybe we're not used to noticing because we're living in so much stress and busyness and go, go, go and high energy. Um, so I wonder if I can see the chat again. I will after. But I just want you to take a moment right now and write to yourself or in the chat if you feel like sharing it. It's up to you. But I can bet that each of you have had a moment, even for a millisecond, where you have been in the safe and social state, even today or in the last 24 hours. So this is your morning coffee, your afternoon coffee, your midday coffee. I don't know, whenever you take your coffee or tea, feeling the sun on your face, hugging someone that you enjoy, petting an animal, even looking outside, like as I asked just earlier in this session. That is bringing you closer to the safe and social state where your parasympathetic nervous system is starting to get engaged and you start feeling even a tiny bit more calm, a tiny bit maybe more compassionate or clear. Yeah, maybe even some birthday celebrations or gatherings or, holidays. That's a mixed one, but for holidays, if for you and your social network and your family, if that feels like a place of connection, then that can be one of them. Food is a great way of connecting with yourself and activating that parasympathetic nervous system. Trees, yes. Yeah. Thank you for sharing. There are moments, if we pay attention to them, if we take the time, which is hard to find sometimes, we can actually start identifying those moments. So why is safety and connection so important? Well, at the base of it, they are protective factors. So research has shown that they're protective because they actually help to reduce the impacts of traumatic experiences by breaking the stress cycle. So the stress cycle is kind of what we identified just a few slides ago, for instance, with the four F's: flight, fight, freeze, and fawn, that get automatically activated. When they're activated, if you are aware of it and you notice, oh, I'm in this activated state, you can now have a clearer direction as to what you need to do to break that cycle of stress, which is safety and connection. And I'm going to break down what that can look like in a few slides, but just at the very kind of the simple kind of or at high level, finding safety and connection are protective factors. Breaking the stress cycle moves us into the parasympathetic nervous system, those 7 C's that we just talked about. And what that does is that it brings our brain back online. I forget his name. Dan Siegel talks about the brain in as a kind of hand metaphor. And when we are activated, when our stress signals have been activated, our frontal lobe right here, which all of you are using right now to pay attention, gets activated and it literally flares up. And we're like a chicken with its head cut off. We're like running around, not really fully kind of present, understanding, and it's harder to do things. But when we break this stress cycle, we can bring our frontal lobe back online, and that helps with executive functioning. It helps to slow our breath and heart rate down, which means it relaxes our muscles. We start to have more fluid, spontaneous movements as opposed to rigid and stiff. And it helps us to actually lean into even more connections with other people or other beings. So, all of which are an easier and maybe more fulfilling way to live. So, there are three main ways of cultivating safety and connection in our lives. That's within ourselves, within our relationships, and within our environments. And some of you have kind of mentioned already some of these things that you're doing that kind of can be placed in these kind of three main ways. So I just wanted to kind of talk about what it's like to find safety and connection within yourself. And that can be through some self talk, hopefully, a more neutral or positive self talk or compassionate self talk, some meditation, some journaling, some counseling, maybe some exercise, reading self help books, or listening to podcasts. What it looks like within our relationships. It's actually trying to maybe engage in more formal ways of connecting or reconnecting with them through friends, couples, family counseling, maybe even setting some weekly check ins. So it's in your calendar, and you know that on Thursday mornings, you're going to have a little check in on how we're doing. Maybe it's creating dinner dates with not just your partner, but friends and other family members as well. That's really important. Maybe trying new hobbies or being part of special groups like this one. And we can't do a million things at once because we know you're already doing too much already. But if you can find a way to do one or to continue doing or giving yourself more time to do one of these things, um, we start to continue to break the stress cycle and offer yourself more of that safety and connection. And then what it looks like in our environments, I think some people kind of talked about that, but just kind of going outside and watching the birds and maybe observing the water. Actually, research has shown, and I don't know where that was, but water is especially calming, even if you're not a water baby or anything like that. Actually, just observing flowing, moving water is has shown to be really relaxing for our nervous system. So that's a nice little tidbit. And maybe engaging in some mindful walking, cycling, things like that. So with an environment that is uh, outside of you. Just gonna check the chat here. Oh, yes, thank you for linking that. Yes, gardening. And there is a gardening, whoops, I believe course that's part of the BC Brain Wellness program.
Yes, there is. You're
Yeah.
absolutely right.
Okay, it's still going. Okay, good. Yes, and the mindful course. There's so many beautiful courses being offered. Um, so I wanted to take the next few, kind of maybe half of the presentation to actually do some exercises with you to kind of increase the tools for your toolkit. And so I'll be sharing, yeah, some of the ways that you can start or restart feeling safe and connected. And I think it's important to know, like sometimes when you do something but you don't know why you're really doing it, the results are often disappointing. So if you're just, joining the mindfulness course just because you know mindfulness is important, but you haven't connected to it for yourself personally, the effects of the new tool, like mindfulness, is not going to be as big as if you have a personal reason and something that is meaningful to you to start to change. That's why we need to know where we're starting off from. That's why I wanted to talk about the stress response and, kind of briefly go over some traumatic experience knowledge, just so that you have, or you can start identifying ways or areas in your life that you notice yourself going into the stress cycle, and you notice yourself maybe people pleasing or fawning, and you notice yourself picking fights with the grocery person that literally has done nothing for you except for pack your groceries. Like, um, I think knowing where to begin often leads to better results down the road when we're creating that change. And so, again, that's part of the self awareness, the emotional awareness that we want to have and to start cultivating to create that change that you so deserve and are fully capable of doing. So, one of the first exercises that I wanted us to do today, it's a breathwork exercise, and you probably have had many people talk to you about breathing, and I'm going to be another one of those people. But it's so important to learn how to breathe in different ways because it actually helps. It is always with you. If you are here today, you are breathing. And it is such an accessible tool to have immediate results. And so you don't need to go to a certain environment to do it. You can literally do it in the checkout line, wherever you are at in the store, right? You can do it at dinner. You can do it, all these different places. And so we're going to run through it together, but this particular breath, it's called the sigh breath or the physiological sigh, um, is one that is kind of maybe more recently popularized, but it's been around for a long time. Uh, it helps to interrupt the threat cycle in the here and now by actively shifting the way that you breathe to signal to your body you are safe. When you are going to bed or when you are tired, we actually sigh, I think, like every fifth breath or something like that, but we don't even notice it because it's so subtle sometimes. But sometimes it can be very, very obvious, as my partner always says to me, you're sighing again. Um, but it's a really powerful way to shift from a sympathetic activated nervous system to a parasympathetic activation. And so when you deliberately alter your breathing pattern with a sigh, it interrupts the threat system and it overrides whatever the sympathetic nervous system was doing, and it helps you to self-soothe. So it's intended to create some plasticity, flexibility back into your mind, body, soul, and it's offering you an opportunity to check in and to shift your state. And as the screen shows you, it's a very simple and it really mimics the sigh. And you're probably going to do it and realize, oh, yeah, that is how a sigh works. Um, and you might even sigh as you practice this this breath work because I definitely do, and I've seen other clients and family members do it too. But what it looks like is that you inhale deeply, you inhale again at the top of your breath, and then you just let it all out. So it looks like this. Okay. And if you do it a few times, about 3 to 4 times, you really start to notice at the end of your exhale, a slowing down. So I'm just going to stop the screen share and I'm going to we're just going to run through the exercise together so I can kind of see people. Yes. So the sigh breath imitates a sigh, which breaks the fear or stress cycle and allows your system to relax. And the second tool is one of my favorites. And for those of you who know me, this is going to be a repeat. But it is an emotional and mental awareness tool that is like a map, and helps us to start to change not only our state, but also our emotions. So we are often very good at knowing we are stressed or knowing we are uncomfortable because those signals in our body are very loud and proud. The change triangle, which I'll show you in a slide next, is a way of identifying and releasing our emotions. So it helps us to acknowledge and to move forward with what we are feeling and therefore change how we are feeling. And we can find lots of beautiful resources on all of these tools, but specifically this one from Hilary Jacob Hendel, sorry, on her website. So the change triangle is as you see with the blue arrow, is a way of directing ourselves out of these big, loud, and uncomfortable emotions into our core emotions, which are fear, anger, sadness, disgust, joy, excitement, and sexual excitement. And just getting to our core emotions is a lot of work. So do not think that you need to know what you're feeling at the core of your experience. It is very difficult to get there because emotions are uncomfortable. And for a lot of us, we've been socialized to forget about emotions, push them away, ignore them, put them in a box, never come back to them. But actually, when we do that, we actually do ourselves a disservice. And because we are beings that experience the world, we are going to feel not just anxiety and stress, but also these core emotions. And so, if we can get curious enough to start feeling and paying attention to these core emotions by literally just acknowledging, I feel sad, period. Sometimes that can be enough to shifting our state into that open-hearted state or the 7 C's as we were talked about earlier. But it's not what you do, it is how you do that acknowledgement that matters. And it also, I think, applies to many things in our life. It's not what you do, it's how you do it, right? So the energy with which you do something matters. And again, it's like, if it's not meaningful for you, if it doesn't resonate with you, the change is harder to do, even if you do mindfulness, even if you do exercise, even if you do all the things that you're supposed to be doing, how you do it matters. So if you tell yourself, oh, I'm feeling anxious, is there anything else that I could be feeling underneath this stress and anxiety? Oh, I am feeling sad because of this changing diagnosis. Yes, and I am going through a lot of grief, and I am going through a lot of sadness because of that. And I'm oversimplifying it, so it doesn't necessarily sound like that in your head, but just for this purpose of this class, I'm kind of keeping it concise. If you tell yourself that, okay, this is what I'm feeling. I am feeling sadness. And you put a hand on your chest because that's what I do when I need some comfort about what I'm feeling and I'm going through. And you just give yourself permission to name that core emotion. All of a sudden, a softening happens, and it can be really tender, by the way, naming those core emotions. You can start to cry, you can start to breathe more heavily. That's okay. That's part of the movement of this blue arrow. all of a sudden you can start feeling more clear about what's happened to you. Yes, I am feeling this, and it makes sense. Of course, I would be feeling this sadness. Okay, I feel a tad bit more connected to me because now I know what I'm feeling. And maybe because of that acknowledgement, I start to feel a little bit more calm, give myself a little bit more grace, give myself some love, some compassion for what I'm going through. So, this change triangle is a beautiful tool to help you start to move out of these really intense and difficult and uncomfortable and stiff experiences and into something softer, more gentle, and hopefully more tolerable. Okay. And so we're not going to run through that together, but what we will run through together is this other tool, and it's a tactile or physical tool. It's one of my favorites as well, which is why I keep sharing it, but it's the butterfly hug. And we'll do it together in just a little bit. But what I want us to know about this tool is that it's a grounding tool and it's one that brings us in the here and now when we're sometimes kind of just floating in our head and out and we're not fully present of what's going on within ourselves or even with our partner or with our surroundings. And it's a really nice way to tune into our being or into our body and observe a physical shift in our experience. And so I'm gonna stop this screen again, stop the share, come back to the group.